Hey everybody, it's Dr. David. So, if you know me well enough, you know that I have been a very big proponent of breastfeeding, and this goes back to my earliest formative days back in my residency in the 1990s. It was drilled into us so wonderfully at Tampa General Hospital of all the important benefits of breastfeeding, both psychological, developmental, health wise, etc. And it was also my pediatrician that I grew up with. After I was born, and therefore was formula fed, actually, he became the international medical director for the La Leche League. And so I've had wonderful, wonderful mentors throughout my career who have reinforced my strong feelings about breastfeeding. Now, I realize that it's not for everybody. I realize some women can't because of feeding issues or other types of breast issues or work, time consuming or whatever. But it is rather conclusive now, has been for a while, that breastfeeding is best. That there's really, yes, formula feeding can certainly give proper nourishment, etc., to the baby, but the benefits of breastfeeding is just so overwhelming that we'd be remiss if we didn't really push it strongly. So even when I'm working with a newborn family and we talk about breastfeeding, and I go over all of the different things with timings and positions, but I will tell them, I'm going to be really hardcore on you during these first 2 weeks until the baby gains weight back, because after that you get into cruise control with it, and it makes such a big difference. And in our practice, of course, almost all women wish to breastfeed. I've only had one mom who actually said from the beginning, we're planning on formula feeding and please don't ask me. And out of my respect for the individual, of course, that was the end of that conversation forevermore. All right. So, as far as some of the benefits, okay, and there are many, many benefits, but I'm going to give you my top 5. Okay. Number 1, in terms of strengthening the immune system. Now, antibodies are definitely one of the things that are found in breast milk that cannot be into formula. Now, there are people who can add bovine colostrum, cow-based colostrum to it, but the amazing thing about breast milk is that within 4 hours of a breastfeeding mother getting exposed to any virus or bacteria, they're already putting the antibodies into the breast milk to protect the baby that may very well be exposed to what mom was exposed to in terms of everybody else. But even if mom starts to catch a virus or bacteria, already the antibodies are there in the breast milk. And when the cord is cut when the baby is delivered, antibodies are passed along from the mother to the fetus through the umbilical cord in the form that's called IgG. That's one of the antibodies. Now, that's the antibody of long-term immunity, but that's when the body's actually making it. So once the cord's cut, there's no continued production, but it certainly is there for the first few months when the baby's immune system is least mature. Okay. Now, so in addition to that, there are also other things because of the bacteria, prebiotics that help feed the intestinal flora. So of course, making sure that we have good microbiome, and the breast milk really does feed that as well. But also it doesn't just go down into the gut and to protect the gut. When a child is breastfed, getting breast milk, it goes to the back of the throat, the back of the nose. And there is, of course, a lot of the places where we first see respiratory infections through our nasal cavity, upper respiratory, before it goes down. So there's a coating of up here, not just down in the intestines, that's happening with those antibodies as well. So really, really first line. And the antibodies that we have on our intestines and in our nasal passage respiratory tract is called IgA. That is the same antibody that is in breast milk. So it's right there ready to go. Okay. Now, as far as another thing, it's the perfect food. Okay. Starting off from day one, it's colostrum, that thinner type of liquid there that's not fully fat yet, where the intestines are kind of just starting to get to learn how to do their thing, and so it's a little thinner type of substance to kind of like almost ease them in a way. Okay. So it's the absolute first food, the perfect first food. Of course, breast milk consistency overall does change, as babies get older, fat content and things change, but of course formula, it does not. So it grows with the baby. It's pretty cool that the system that we've developed that way, that mammals have developed that way, it's pretty remarkable. Now, The fats, the carbohydrates, the proteins, it's all in there. It's all in the perfect ratio. Formula, breast milk, I'm sorry, cow milk formula, soy milk, any other plant-based formula, it's all built upon the consistency, the constituency of breast milk. Okay, omega-3 fatty acids, which have always been in breast milk, now have been more recently, decades now, fortified with omega-3 fatty acids, in particular DHA, which is super important for brain development. So it's naturally in there, and then of course it's added to formula. Okay, so now of course when you start talking about the antibodies there, another great benefit is just overall the reduction of infections overall. And not just infections, other diseases as well. So there are plenty of studies we've conclusively proven now reduced infections, ear infections in particular, sinus infection, respiratory infections, but also we've now shown that there's lower incidences of diabetes, for allergies, and also even childhood leukemias are less common in breastfed babies. And of course, that's true whether it's pumped breast milk or if it's right off of the breast itself, because the nutrients are there either way. Okay, now another really big benefit is the improved of long-term brain development cognitive function. Okay, now this was something that was taught to me very many years ago. Dr. Frank Oski actually is who taught me this. He was really the forefather of American pediatrics. He literally wrote the book, the textbook. Oski Pediatrics was one of the two main textbooks that's always been used. But I had a lovely experience when he came to Tampa General. I think I've talked about this before, where he shared with us his book called "Don't Drink Your Milk: Scary Facts that the dairy industry doesn't want you to know." But one of the things he said in that lecture was that all things considering, where they take into account the family, the background, education of the parents, schooling, everything, breastfed babies on average would get about 4-point boost in their IQ. And one of the most memorable things that he said to me in this lecture actually was, 4 IQ points may not sound like a lot, but I'd sure like to have them now, which is pretty cool. Also, it does seem as if the benefit is even more pronounced for premature babies. Okay, so the more premature the baby is, the breast milk just has more development improvements there as well. So of course, it's more difficult to nurse a breastfed baby, but that's why we encourage babies who are premature, if they can't be breastfed because they're too premature, that the mom is expressing the breast milk, and we're giving the baby, whether it's through a nasal tube or all other different types of apparatuses that could be used, finger feeders, supplemental nursing systems, etc., in order to get the milk there. But the importance, more than anything, is that it is the breast milk itself. Now, in addition to that, there are lots of benefits to moms as well. Okay, first of all, there is usually a faster return to pre-pregnancy weight. Weight loss does seem to. Now, I've clearly had some moms say, that didn't do it for me." But overall, the research does show a woman is much more likely to get back to her pre-pregnancy weight when she breastfeeds. Okay. In addition to that, it also lowers the chances of getting postpartum depression. It does actually lower the incidence of breast cancer and ovarian cancer as well. Obviously, those are super important. But it also, especially when nursing itself, it's a time saver. There's no cleaning of bottles. There's no having to express the milk, sterilize the bottles, prepare, obviously compared to formula, where you have to prepare the formula itself, you have to heat up the formula, etc., like that. Now, of course, if there's express milk, some of those things still have to happen, but nursing itself has those types of benefits as well. So, of course, it's a money saver too, right? Because it's kind of free there, and formula got pretty expensive, and it's since we have the shortages, and it isn't cheap, so breast milk is free. Okay, so there certainly are more benefits than this. I could probably talk about this for a couple hours, but at least now during breastfeeding month, here we are in August. So so now you know more about it, and maybe this will inspire people to more likely breastfeed. Or if you know anybody and you want to give them some little pointers here, there you go. Have a nice day.